Okay, so this is the continuation of the extradural hematoma. So this is second video. What are the ways to measure ICP? So we have like different methods. For example, we have the intraventricular catheter, intracranial transducer. So intraventricular catheter is the gold standard, allows drainage of CSF to lower ICP, re-zeroing or calibration possible. So you can calibrate it according to your own facility. And but this is the most invasive method. High infection rate may be difficult to insert simultaneous CSF drainage and ICP monitoring not possible, and it can lead to other injuries as well. Intraparenchymal probe. So low infection rate but measure local pressure drift of zero over time. Subarachnoid probe. So low infection rate, no brain penetration, limited accuracy, high failure rate, periodic flushing necessary. Epidural probe. So low infection rate, easy to insert, no penetration of dura, but this is limited accuracy, relatively delicate. Lumbar CSF pressure. Extracranial procedure. Inaccurate reflection of ICP may be dangerous when brain edema is present. So when there is a high pressure and you do lumbar puncture, it can suddenly decrease the pressure ICP, intracranial pressure, and can lead to herniation. So this is very dangerous. That's why lumbar puncture is contraindicated in raised ICP. And tympanic membrane. So what will you do? Like, it's okay, so it's a sideway question, but here I'm asking you, like, what will you do if you have suspecting a high pressure and you are going to do a lumbar puncture? So how to confirm? So you can go for simply for this ophthalmoscope, check the retina and macula. So look for papilledema. So if there is no papilledema, so you can go for lumbar puncture, because, and if there is, so always avoid it. Tympanic membrane displacement, non-invasive but insufficient precision, and it's just an estimate. Transcranial Doppler, non-invasive but limited precision. So the best and gold standard is the intraventricular catheter, because your CSF is always in the ventricle, so it will give you the highest translation or the highest idea of a very good idea of the intracranial pressure. So what are the indication of ICP monitoring? Conditions where ICP monitoring is used. So traumatic head injury, intracerebral hemorrhage, subarachnoid hemorrhage, hydrocaph, malignant infarction, cerebral edema, CNS infection, hepatic incursion. So in such condition, you have to check the for ICP or monitoring of ICP, because anytime soon this can raise and can lead to the dangerous consequences. What is the danger of lumbar puncture in increased ICP? So herniation and coning. So brain herniation, subfalcine subfalcine herniation, the cingulate gyrus. Here you can say the cingulate gyrus is herniating under the falx cerebri. Midline shift is evident. Intracranial pressure, uncal herniation. The temporal lobe is herniating over the tentorium cerebelli, where it can compress the third nerve. Central herniation and tonsillar herniation result in brainstem compromise, manifesting as Cushing triad. So what is Cushing triad? Raised ICP, intracranial pressure, bradypnea, and you can say the you can say hypertension, bradycardia, and bradypnea. Bradypnea means low or irregular respiration. What would you do? Who would you call for help? My consultant, neurosurgeon, anesthetist, ITU registrar, and relatives of the patient to counsel them. What is Cushing reflex? Physiological nervous system response, mixed vagal and sympathetic stimulation to an elevated ICP that results in Cushing triad. It leads to hypertension, which ensures an adequate cerebral perfusion pressure. There is also resultant bradycardia and irregular respiration. So why hypertension occurs? Hypertension occurs when there is a raised ICP, because body wants to do perfusion of the brain. So remember, this is your skull, there is raised hypertension, raised ICP, so body will automatically increase the hypertension blood pressure. hypertension will go up. Why? Because this raised ICP